Welcome back. Your time now, 5:25. A law enforcement officer and martial arts teacher is now back doing what he loves after a robotic knee replacement surgery. In this morning's Health Matters report, we see why this kind of procedure is being called a game changer for patients.
Just relax there. Good.
It looks simple, extending and bending a knee. But for Bobby Teague, this and even just taking a few steps used to cause horrible pain.
The first thing I felt in the morning was my knee, and the last thing I felt before I went to bed every night was my knee.
It all started in 2018 when Teague got into a motorcycle accident.
The leg was shattered.
He had multiple surgeries and treatments, but nothing helped take that pain away, not only impacting his job in law enforcement, but his time spent at his martial arts studio.
I teach Taekwondo and Krav Maga, and every single step hurt.
That's when Baptist Health orthopedic surgeon Dr. Adam Norwood stepped in.
But I'd have felt it for a week.
Yeah.
He specializes in hip and knee replacements and said Teague was the perfect candidate for a robotic knee replacement called a MAKOplasty.
It's a really great technology that allows a less invasive approach because we don't have to pass instruments through the tissue as much.
Dr. Norwood says they're able to tailor the surgery to each patient's anatomy, arthritis, and deformity they have developed.
Based on that plan on the CT scan, we can execute that plan specifically with the robotic arm.
For Teague, the surgery has been life-changing. He went from not even being able to walk a block to now tackling a mile or more regularly.
And in fact, I am 100% pain-free.
From behind the badge to the moves on the mat, he says he can do it all with ease.
I really did not believe that it would be as good as it is today. It's amazing. I believe it's a miracle.
Dr. Norwood says anyone with painful joints that limits activity should get checked out. They can see if you are a candidate for the procedure. We'll be right back after the break.